Hello class, my name is Erin Russell and my project is on special needs groups and disasters. So what qualifies as special needs? Well, according to the U.S. Department of Health and Human Services and our textbook Introduction to Emergency Management, special populations when dealing with emergency and disaster preparedness include mentally and physically disabled persons, the elderly, hearing and visually impaired, people with limited English proficiency, people without vehicles, special dietary needs, pregnant women and sometimes children, persons with diabetes, gender concerns, and certain healthcare needs. The terms at-risk individuals, vulnerable populations, and special needs groups can be used interchangeably. These terms characterize health groups whose needs are not fully addressed by traditional health and social service providers. Some background on the issue. During Hurricane Katrina and Rita, both of which were back in 2005, many special needs people were stranded while waiting for evacuation assistance. This exposed a large gap in social, physical, and economic inequalities among these population groups. 23 million U.S. citizens have special health care needs. That's a 12% of the total population. Some more background continued. The National Organization on Disability, the NOD, launched its Emergency Preparedness Initiative after the September 11th attacks. The NOD recognizes that people with disabilities have a great stake in the effectiveness of public programs aimed at preparing and responding to all disasters. The NOD has two major objectives. These objectives are to make sure that special needs groups are adequately addressed prior to an emergency in order to minimize the adverse impact on people with disabilities and their communities. And the second is to ensure that people with disabilities are included in the emergency planning process at all levels of the government and the private sector so they can offer their insight, knowledge, and resourcefulness. From the text. According to our text, each community must assess its own population to determine what access and functional needs exist and how those needs must be addressed in an emergency plan if it is to adequately protect all of the community's citizens equally. Consideration of access and functional needs population is something that must be addressed in all four stages of emergency management. HADO states the following examples of considerations that must be made. Foreign language training and materials, registry of special needs individuals' locations and emergency requirements, emergency equipment, communication methods, alternate warning media and procedures, protection and service measures, education measures, targeted transportation and holding facilities, and training for emergency responders working with these individuals. Issues and possible solutions. Risk communication. It is important to communicate before, during, and after an emergency. Tailoring messages to specific populations to diverse range of communication methods. Example, large print, braille, and closed captioning. Evacuation procedures, shelter, and care sites. Decisions surrounding evacuation can pose risk of further displacement for special needs groups. Agencies should coordinate transportation options with evacuation facilities. Some more issues. Continuity of services. Emergency management agencies should continue to provide basic necessities, such as food, water, and medicine, during an emergency. Accountability, communication, and responsibility are keys to being successful. There are three barriers that they face. The inability to clearly identify and locate the special needs populations during an emergency. Lack of regular consultation by emergency management and public health officials regarding a needs assessment, and the lack of integration of information from citywide emergency planning. The Center for Disease Control and Prevention, Emergency Preparedness. Resources developed by federal organizations that can help disability-inclusive emergency preparedness and response plans include Nobody Left Behind, Preparing for Disasters for People with Disability and Other Special Needs, Guide to Emergency Preparedness and Disaster Recovery, and FEMA's Guide on Planning for Integration of Functional Needs Support Services and General Population Shelters. If you are interested in more, my last slide is a works cited, and the CDC will give you more information there. Funded state disability and health programs. The CDC's newly funded program, Improving the Health of People with Mobility Limitations and Intellectual Disabilities through State-Based Public Health Programs. Currently, out of the 50 states, there are 19 states participating in this. So 19 total state disability and health programs will work to improve life among special needs groups. Florida is considered a core implementation program, meaning that programs are implementation ready and have existing infrastructure to implement and evaluate programmatic policies, systems, and environmental changes for people with mobility or intellectual disabilities. Fun, well, not so fun facts. 61% of people with disabilities have not made plans to quickly and safely evacuate their homes. 54 million people in the U.S. have some sort of disability. 58% of people with disabilities do not know whom to contact about emergency plans for their community in the event of a disaster. 32% of people with disabilities say plans have not been made to evacuate them from their workplace. Only 16% public awareness campaigns directed at people with disabilities are in accessible format. There are more than 4,000 adult daycare centers in the U.S. compared to 300 back in 1978. About 7.4 million Americans use some assistive technology. Here is my works cited, and thank you so much.